Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello and welcome back to another episode of the Healthy Habits for Active Aging podcast. I'm Dr. Michael Gorman, physical therapist in St. Louis, Missouri. And today, wherever you are, we have a very special guest. His name is Dr. Matt Bays. Dr. Bays I've known for years, and Dr. Bays works in St. Louis, Missouri at a group called Blue Tail Medical. And we are so excited to have him as our guest because his specialty truly has developed into stem cell treatments, and he's going to talk all about that, the good, the bad, the who it works for, and explain it. So Dr. Bays, thank you for being here.
Thanks for having me. I'm really excited and happy to talk always.
Absolutely. Thank you so much. I was telling you before we came on the air here that Lauren Bennett and I, she's my co-host. We did a podcast about 2 hours ago, and I bet you're going to make us look like a bunch of first graders after you're done talking tonight. So thank you very much for being on.
Not at all. We're going to make this really understandable for people, and I'm just so excited to talk.
Awesome. Well, tell our audience a little bit about yourself and how you got into this field of regenerative orthopedics.
Yeah. I grew up always active. I was a really active guy, played sports my whole life. And when I wanted to be a doctor, I didn't know that there was a specialty, and there certainly wasn't a specialty of this back in the 90s. So I actually went into pediatrics. I went to St. Louis University and got just a well-rounded medical education, took a Navy scholarship, and was really blessed to have my training through the military. So when I got out of the military, I was a pediatrician, and I knew I wanted to do sports medicine, but I didn't know how much of that was going to be in the younger athletes. So I actually did a fellowship at St. Louis University in primary care orthopedics. And coming out of that, I just fell in love with the active adult, the active athlete. We're all adults. If you move at all, I consider you an adult. And even if you don't move, let's say you're, quadriplegic, paraplegic, I still consider you an athlete. So there are ways that we can maximize our movement. Some of us get paid to do that on the professional level. Most of us don't. And how do we use medicine and in our education to make that better? That fell right into my comfort zone of A, procedure-based, B, active people living a lifestyle that I choose to live as well, and people that really want to get better. So one of the problems I have with medicine as it stands now, and when I had that in pediatrics, was we're treating sickness. We're always reacting to illness. And, it's just such a hard job and a hard life we lead. I have so much respect for family medicine and pediatric doctors who do that. But I would say I wanted to be more involved in helping people stay active and stemming off disease as opposed to reacting to disease. And that led me into my specialty. So right after fellowship, I did a 3-year job at the Orthopedic Center of St. Louis, which was like a high-end sports medicine orthopedic fellowship for me as a non-surgeon. And I really got well trained in all these knee and shoulder and hip and elbow surgeries. And then I started to refer my patients to some friends, and they were doing PRP and stem cells. And I thought, wow, that is interesting. I got educated, and I noticed their outcomes were just as good or better for patients who would qualify. And so I said, I think I'm going to leave and join them. And that's what I want to devote myself to. So that was 12 years ago. Okay. And I joined, and God, I'm so blessed to have great partners and people I learn from every day. And my whole goal, I always tell young people, because I take, shadowing med students and college kids and residents, I'm the luckiest guy in the world. I get to be involved in helping people feel better and move better every day. Now, obviously, certain people are better or worse than others, but right. Our goal is just to make people happy and healthy. And I truly believe exercise is medicine, and that's what I've devoted my life to. So that's a super long question to your answer, or
That was
answer to your question.
that was great. That was great.
Yeah.
So I guess you've kind of already answered it, but as you got into the field, and I know it's changed a lot since 2010, but as far as PRP and stem cell, is that what you call now? I think you call it orthologics. Is that the
Yeah,
term for it?
close. Orthobiologics.
Oh,
So you were so close. I'm gonna give you A-. Biologics meaning our body, and then ortho meaning application in the orthopedic realm. So there's biologic application in everything now, Mike. They're regenerating the pancreas in diabetic patients. They're treating cancer. You sent me a great article on Parkinson's disease. That's going to be coming down the pike. Everything has this, but this is our specialty is sports medicine orthopedics. And let me give a little bit, just like a 30,000-foot view of what that means.
yeah,
Is that a
for
good
sure.
idea?
Yeah, absolutely.
So what we do is in orthobiologics, all we're doing is really taking your body's ability to heal, harnessing it by taking it from you in a very, minimally painful way, concentrating it and making it more concentrated, and then injecting it very, very precisely through the use of ultrasound into the problem area. So, I firmly believe there's a greater being. We were part of a plan, and God made us to heal. And that's not about religion. That's how we were made.
Mm-hmm.
That is a wonderful, wonderful engineered system. Well, certain parts of our body as we age have less blood flow, or there's been an injury, or there's a degenerative process like in your knee arthritis or hip arthritis. What we can do is take those cells that help you heal and then put them where they were meant to be but aren't getting there. And that's really what we're doing. So two things you look at. We look at platelets, which is platelet-rich plasma, or PRP, and then stem cells, which is your source of the building blocks in your body that we all have. So our stem cells are everywhere in our body. We can get them very, very easily from our bone marrow and our fat, and that's adipose. That's a little liposuction or a little bone marrow aspiration, and that takes probably under 10 minutes, and it's very comfortable.
If you can you get me in the office tomorrow for some of that liposuction? Is that a possibility? You got any extra tools?
Yeah, I had two patients today. They both made that joke that usually about
you probably hear that about 80 times.
I usually do about 2 procedures a day, and that's about 90% that people make that joke. Yeah. Yep, absolutely. So yes, absolutely. Yeah. But unfortunately I'm not a plastic surgeon, and I don't put it back. I just take it and discard it. No, I use it for its stem cells. So anyway, those two sources of stem cells are the building blocks that can grow tissue. And then the PRP, or platelets, are the growth factors that really give the information that you need to those cells. And we inject them together. Let's say you have a partial tear to your rotator cuff, very common in our aging athletes. Maybe you fell down the stairs and caught your arm on the railing, or maybe you caught a brick that was falling, or lifted too much in the gym. Well, you're going to tear that rotator cuff that comes around right here to a varying degree. Now, sometimes you need to have surgery, sometimes you don't. If you don't, we can take those products and inject them under ultrasound guidance into your rotator cuff and really, really help it heal and avoid that really hard recovery for a rotator cuff repair.
Perfect. And so when you take the stem cells, a common place you take it from is the hip, what's called the iliac crest. Is that correct?
Yes.
Okay. And so once that does not seem like it's a fun thing to do, but I'm sure you do it very well, and it's probably not as painful as it sounds. But then once you pull that out, you're pulling the stem cells out of the bone marrow. Is that correct?
Yeah. So first thing we do is, number one, we're all about patient comfort. Okay. So if anyone knows anyone who's had a bone marrow, or if they've had cancer or donated bone marrow, that's a really, really painful procedure in an oncologist's office. We are a different setup. Okay. We are a really high-end orthobiologic office. We want people to be comfortable. So we play music, because I firmly believe in the healing power of music and the relaxational effect. We use laughing gas, just like if you're going to your dentist to get a filling. And that's really, really cool because you just don't care what's going on. We use a lot of local anesthetics to make you comfortable and relieve pain. And then we're just, frankly, just really good at this. Like I've done over 2,500 of these. And I always knock on wood. I'm going to knock on my chair right here. No one has ever quit. I've been doing this since 2012. No one has ever quit. No one has ever said, oh my gosh, take that needle out. I can't do this. It doesn't happen. So we just make you really comfortable and we're done before you know it happened. A common thing that people will say is, which is crazy, when I'm treating knee OA or knee osteoarthritis, I usually use about 6 or 7 shots. And people will say it was more painful to inject my knee than it was to take the bone marrow, which blew me away at first, but now I know it's real and I've had it done myself.
Yeah. Yeah. And so, all right. So you extract, so you're pulling the bone marrow out. Is that correct?
Yes.
Okay. You're pulling the bone marrow out, and then tell me what that next step is, so just kind of talk through that. We don't have to go super in depth, but I just want people to really understand, because I think there's, to a lot of the people in the US, there's a kind of a mystique about what PRP, what stem cell is. You might read about it online or something, but no one really knows. And so when you talked to our group last week or 2 weeks ago, I was just overwhelmed by how little I knew, and I thought I was educated. So anyway,
yeah. Well, I mean, again, all we're doing is concentrating the body's healing ability and putting it where it needs to go, because it's not getting there on its own to the degree that you need to heal. So when we draw the bone marrow, we put it in a centrifuge, which is a super smart, like proprietary centrifuge from a company that can concentrate down the cells we want and discard the cells we don't want. And that's really genius. I mean, biomedical engineers that are way smarter than me are doing this. And then we take that and it comes out in a little vial of like 3 to 5 cc's. It's very small concentration. And we put a tiny needle on it. And then we're going right under your skin into either your rotator cuff, your patellar tendon, your knee arthritis, your hip arthritis, fingers, toes, shoulders, what have you, spine. And that is, again, we make the patient as comfortable as we need to be. It's not, I had my spine treated in 2016 without laughing gas. We didn't have laughing gas. And so I got the bone marrow without it and the injection without it. And I thought it was a 3 out of 10 pain like the whole time. And I thought it was very, very tolerable. So the one thing I say is this isn't for everyone. Like a lot of times we see patients under insurance and we're just interviewing them and examining them. We're trying to figure out who we can help. And a lot of times people will say no, and that's fine, like for whatever reason, but let's do some more tried and true, therapy, like excellent physical therapy goes a long way. I mean, your specialty is always evolving, right? Like you guys are now doing dry needling. You're doing A-stem, you're doing blood flow restriction, you're doing Graston, maybe cupping or what have you. All these things, like specifically dry needling and A-stem, improve blood flow to tissue. Well, what comes when blood flow comes is platelets and stem cells. So all we're doing is that's like for a bad analogy, that's like a knife fight. We're bringing a nuclear bomb and we're just like, boom, we're going to fix this. But under insurance, much more affordable, skilled physical therapists who use their hands like you and your people can oftentimes fix what people need. And we're all about that. Like I saw 25 people today and probably, at least 20 were not candidates for my stem cell because they had not gone through the normal channels, which is, hey, that's some normal treatment in physical therapy.
Right. And so like, is there a certain age range that regenerative orthopedics, orthobiologics works the best? Or like what age do you, because this is a Healthy Habits for Active Aging podcast. So a lot of our topics are people like 50 and older. Hello, I'm in there. Yeah. And so what age range responds the best to this treatment?
Well, I mean, we all wish we were 17-year-old boys again, right? Because you could run through a wall, you would get hurt, and you'd come right back. It's all hormonally and physiologically driven. So, we were, at one point we were just cavemen, and cavemen got eaten by the saber-toothed tiger when they tore their Achilles because they couldn't run fast enough to get away. Most cavemen did not live to 90, right? No, none of them did. So we're outliving kind of where we've been programmed to live. So to go back to my first point, no one has more testosterone in their body than a 17-year-old boy or girl, for that matter. They're all programmed to heal. As we get past 35 and 40, that starts to drop a little. And I'll make this so people can see it. As you're getting to 85, we start to talk about falling off the cliff. So I don't consider someone too old for stem cells. And I use your own stem cells. I don't use anyone else's. I don't use embryo stem cells. That's illegal. I don't consider them too old until they're physiologically not ready for this and or over 85. Caveat, we've all met these people, Mike. The 93-year-old man or woman who's on no medication, they're blessed to be healthy, they have no dementia, and they're hanging out healthy. They are much more ready to heal and much more programmed to heal than the unhealthy 65-year-old who smokes, has uncontrolled diabetes, and just kind of like not doing well medically. So you have to take everything into account. It's age and health together. And I'm way more interested in their health. And that's why our clinic does a bit of a thorough review of your health. We do some lab work. We check your hemoglobin A1C, your vitamin D, your platelet count, your hormones. And we want to give you a good prediction of how you're going to do when you treat with us.
Yeah. So you're looking more at physiological age, not so much the chronological age, right?
Absolutely. But we do know that there is data out there that after age 85, we have fewer and less active stem cells. And we can't deny that. But I've had people over 85 do well by that same token.
Yeah. And so when you put stem cells into a knee, let's say this is a patient that has bad osteoarthritis, not a whole lot of cartilage left in there. I think our audience is curious, is when you inject the stem cells and maybe a year, 2 years afterwards, what is does new cartilage grow in there? We know it's not going to be like it was when they were 17, but what happens in there?
That is really the most important thing to understand, is really what happens after we inject your stem cells. So we call it a paracrine or niche effect. Is those stem cells get in a joint like the knee, which is the most common thing we do, the knee arthritis, because 60 million Americans have it at least. It changes the environment from an inflammatory, degradative environment. So it's like everything hurts. There's all these mediators that are inflammatory. They're making negative changes being released by the damaged cartilage. And the stem cell gets in there and it down regulates those bad things and it upregulates the good things. So there are similar but opposite effect cytokines or messengers in a cell or in a joint. And those are anti-inflammatory, anti-painful, anti-swelling. And it makes those more plentiful while making the bad things go away to a certain degree. So I make the analogy of like changing the oil on your car. You're supposed to change the oil every 3,000 to 10,000 miles, depending on the car you drive, synthetic oil, whatever. If you go too long, your corrosion in your engine begins and bad things start to build up. The oil becomes thick and sludgy. The metal starts to wear and grind. Everything goes to hell in a handbasket. Same thing in your joint. So if all you got to do is take your car into the Jiffy Lube and you pull the bad oil out and good oil in, that is similar to a stem cell in it, like a somewhat weak analogy, that we're taking the bad stuff out and putting the good stuff in. And that's why our treatments in knee arthritis, our treatments are, our research states and shows that these last 5 to 7 years. So why doesn't it last forever? Well, knee arthritis is a progressive degenerative condition. We can't stop that unless you get a knee replacement.
Right.
And our goal is to avoid that unless it's necessary. But we can semi-permanently, not permanently, but 5 to 7 years, slow that down, make you comfortable and keep you active. And then guess what? Let's say you're 30 pounds overweight and I get you walking or riding a bike now with less pain. Suddenly your weight comes down. Then your A1C comes down. Then your glucose homeostasis gets better. your cellular homeostasis gets better, lipids improve, everything goes in the right direction, and you feel better. That's our goal. And we can repeat our treatments every 5 to 7 years. Or if you say, you know what, this wore off and I'm just ready for my knee replacement. I'm 73 and my knee's hurting badly and I don't want to go through this again. Great. Let's hook you up with a good surgeon. We have a good network of people.
So let's say I'm a patient, let's say I'm 65 and I have moderate knee osteoarthritis. And I'm trying to figure out, should I get injections that are like cortisone injections that are covered by insurance? Should I go that route, or should I go the stem cell route? Like, is there, if I'm trying to figure out, and again, I know that it's, what you do is cash pay, and I think it's worth every penny of it, but why would I not want to go the cortisone injection route, whatever they can do 3 or 4 year, compared to stem cell?
Yeah, great question. And, obviously low hanging fruit here. We take insurance for our initial evaluation. We do probably 80% of what I do on the patient volume status is under private insurance. So we're still walking people down that route, and we can do those things. So let's talk about, like I always talk about, choosing off a menu. Let's say you come in with knee OA and you're not bad enough for a knee replacement. Well, the first thing you can do is lifestyle modification. Let's talk about weight loss, because every time you take a step, 2 times your body weight and force goes through your joint. So let's say I'm an even 200 pounds. Every time I step down, 400 pounds goes through my knee. If I'm going downstairs, that's 400 pounds. If I'm running, that's 600 pounds. So if I can help you lose weight, and I'm talking 10 pounds or 15 pounds, nobody talks about 100 pounds. That's a long, slow burn. That's, if I lose 10 pounds, that's 20 pounds off my knee when I step, 40 pounds when I go down the stairs, 60 pounds when I run. That's a big deal. We talk about smart ways to lose weight. We talk about flexibility and strength. Anytime anyone has a knee arthritis diagnosis, within a couple months, they've lost, I think, Mike, you would know this, I think it's 15 to 30% of their quad strength. Is it automatic? Like, we see it, we can measure it, we can feel it. And if you have less muscle strength, you have less cushion and slowing down the landing of your thigh bone on your shin bone. So physical therapy, physical therapy, physical therapy. I have patients every day who laugh at it. And I say, look, you got to try it. And physical therapists they're just like doctors. I have people who do my specialty that are really, really bad at it, and I wouldn't recommend them. There are really, really bad physical therapists out there. I want people to go to someone who knows what they're doing and has really, really good training and experience. So that's very important. Next step, injections. What can you do? Well, steroids are what I use for, like, when I have a person who's going on a once in a lifetime vacation, they want to go to the Amalfi Coast and they want to do a bunch of hiking and go to Rome, what have you. Let's give you a cortisone shot. Let's get you a good vacation, but you're going to be back in 6 weeks saying that we're off. We know that. And that's a chemical effect that just downregulates that inflammatory condition. But it's going to wear off. And ultimately, if you get multiple steroid shots, it will degrade your cartilage. And that's proven. So a lot of people hear that. They're like, ooh, I hear steroid shots are bad. Well, when you use them in a limited directed approach, they're not bad, but you just don't want to get someone started on a pattern that they're going to need the rest of their life. Next shot, a gel injection that's called viscosupplement or hyaluronic acid. We can do that. Certain insurances allow it. Certain insurances don't allow it. Think of that as, go back to my old oil engine analogy. That's new oil in your engine, and it's super safe. It's a protein. You're not going to get anything bad happen, and it might help you to a certain extent. I love it. I do them all the time. We talk about supplements, glucosamine chondroitin. We talk about collagen supplements, natural anti-inflammatories like curcumin and turmeric. We talk about finding inflammatory conditions. So a lot of times I have a knee pain patient and I'll be like, I think you might have psoriatic arthritis. And then they go to the rheumatologist and get tested, and voila, they don't just have osteoarthritis. They have an inflammatory condition in their body. That's where I have to put on my hat of like, hey, I'm a real doctor. Keep everything in mind. refer when necessary, and let the experts really help these systemic conditions. And then last but not least, hey, there's a stem cell and a platelet injection or a knee replacement. And we got to talk all about that stuff.
Yeah. Okay. So great. So there's obviously a lot of options out there. There's not one panacea for everyone by any means. And I think one thing that's always impressed me, I've known you for, whatever, 12 plus years, is that you've always been thorough, and you tell people about the options. And I know when I first met you, you were one of the first people I ever saw that was using diagnostic ultrasound. So instead of a patient getting a very expensive MRI, they would come and see you and get, my opinion, a much better test, much less expensive. And from that, you could determine where exactly you should inject someone. And so that's something that you use a lot of as well.
Yeah, thank you for the compliment. I mean, one of the things we pride ourselves in, like I said, is that we've been doing this for a long time now. My partner, Dr. Crane, has been doing it for 15 years. Our only goal is to make people better. And our second goal is to find out who we shouldn't treat and get them to someone who can help them. And so we're trying to find those people that won't get better and not have them spend that money and go through that process. So diagnostic ultrasound is a game changer. So when I hear about someone who does my specialty, primary care orthopedics and sports medicine, if they're not using a diagnostic ultrasound, it's like they're basically in the 1970s of medicine. I mean, how do you see under the skin? It's better than an x-ray for certain conditions. It's better than an MRI for like a rotator cuff tear, but I can't see in the joint. So if you have a labrum tear or a certain kind of a meniscus or ACL tear in the knee, we still do need an MRI. So you have to know when to do it and when not to do it. But we love, and by the way, our patients love it. They're looking at the screen same time as I am, and I'm pointing out the pathology, and they know where it hurts, and they're like, "Yeah, that hurts." And I'm like, "Well, that's a big bone spur pushing up on that the capsule of your knee where there's a lot of nerves, and that's what we're going to treat." So, yeah, thank you for asking that, because that's my one quick tool when I talk to people in my profession. I'm like, "Oh, do you use ultrasound? Like, how do you do this?" They're like, "No, we don't really use ultrasound. We use fluoro." And I'm like, all right. Okay. So that's not very thorough.
Right. Is there a couple tips that you can give to the aging adult that is having, whether it be hip or knee arthritis or really anywhere, just a couple of general tips that you can give to that person to, we know we're not going to change, we're not going to make the arthritis go away, but maybe slow down the progression. And you've talked about a few things, but a couple things?
Yeah. I mean, first of all, don't lose hope, right? I mean, life is hard. We all have stress. It's funny. This is the week before Christmas, and I got home and I just told my wife, I said, "Boy, I'm ready for this week to be over." And
then you had to hop on a podcast.
No, but honestly, this is my passion, Mike. I love this. I just need 30 minutes. I need 30 minutes and a little red wine, and then I was ready to go. There you go. Resveratrol is good in red wine. So anyway, long story short, I mean, don't beat yourself up, right? Like if I'm talking to an active adult, let's say it's a 68-year-old woman and she's 40 pounds overweight, because I don't know any woman who's over 60 who weighs 135 pounds. So when I ask people what their ideal body weight is, if they say 135, unless they're 4'9", I correct them and I say, look, this is the real world. We don't need you to be 135. We need you to be a little less than you are now, and you're going to start to see the health effects of that. So don't ever give up. Don't ever give up, because we can always improve our station in life. The other thing I always stress to people is exercise is medicine. And the little funny thing we say is motion is the lotion, which is an easy thing to remember. I mean, if every American got 30 minutes of exercise a day, do you understand how much less we would spend on healthcare in our system,
be amazing,
in our country? Less on medication, less on surgeries, less on things that I have to do and things that you have to do, Mike. So I struggle when I hear people tell me they don't have time to exercise, because everyone has time to exercise, and exercise is a different thing to all of us, right? I don't mean go run around a track and do repeat 200s. I don't mean join CrossFit. I mean, let's find the way you move your body that doesn't cause pain, builds muscle strength, and burns calories. By the way, that's not even getting into the brain effect of dopamine, serotonin, anxiety, stress, depression.
100%.
All of the studies have shown that time in nature and exercise are far more effective than Prozac or any, Seroquel, any antidepressant, whatever it is, on treating mental health. Not that those medicines don't have their time and place. So, sorry, again, Mike, really long answer. I've really focused on movement. I focus on effective ways to move that don't hurt. So, do you have access to water? Do you have access to a bike, a stationary bike, maybe a recumbent bike? Do you have a soup can in your house? And if you can sit in a chair and do an arm curl with a soup can for 15 reps and then give it to your other hand and do it, you know what? Grandma, your heart rate's going to go up. Your bicep tone is going to go up. You're going to work a little bit of your shoulder and your chest. All of that leads to energy burn and calories and muscle build. And that's all important. So I really just take time and I want to tailor all this to all my patients. That's such a low hanging fruit, Mike, and all my staff talks about it with my patients. Then the next step is, how can we support you medically in terms of like the supplements I mentioned? Do you need a good anti-inflammatory for a short time? We don't want to hurt you. Do you need an injection, and which kind? But movement is so important, and trying to stem the loss of muscle mass, because if we don't use it, we lose it. And anyone who's ever lifted a weight in their life, it's kind of a grind. It's not that fun unless you're a meathead. But at the end of the time, when you're done with your workout, you definitely feel better. Yeah. And you've definitely earned that cup of coffee and maybe that blueberry muffin, whatever it is.
Scone, Matt. Scone. Come on. Scone. No, I mean, Lauren and I have talked about probably in 10 of our podcasts that you lose at least 3 to 5% of your muscle mass every decade after age 30, unless you are working at it. So, it's truly amazing. I mean, just in my own career, the amount of people that once we can get them active, how they oftentimes, if you're in chronic pain and you come into my office or I see you, you're not the person that you normally are. And then once that pain gets under control, it's so amazing to see like that real person in there come out. So I don't want to go too off in the weeds, but it's amazing. So people, I wish, you're right, if people would just give 30 minutes a day, and it's just got to be something that you absolutely enjoy doing. So
yeah. And I've never had a person that I've said, you know what, it's too late. I'm sorry. You're 80, you're 90. It's too late. Wrong. You can always reverse some effects and feel better. I have 87-year-old men chopping down trees that had torn rotator cuffs. I mean, like, come on, like, sure. Don't feel sorry for yourself. Get moving, and you will feel better.
Yeah, and for sure. You also said a quote that I love. I don't know if you know who. Well, maybe he didn't first say it, but you said, "Never give up, never give up, never ever give up." You know who said that?
Jimmy Valvano.
Yep.
Is that right?
Yep. Jimmy V. He was the coach when North Carolina State won the maybe 1984 basketball championship, NCAA, and he was an amazing coach. And he said that when he was dying from cancer in like 1991 or 2, but that's one of my favorite quotes. And how I knew that was from 1984 when I couldn't tell you what I did 2 hours ago is beyond me. But anyway,
because you're a sports fan.
I digress. All right. Yeah. So tell me, I want to ask you as we kind of wrap up here, I want to know what your daily mantra is. What kind of, I don't know, what words do you live by?
Oh, wow. Deep. Boy, you didn't warn me. I don't live by words. I live, boy, this is going to sound deeper. I live by like pattern, and we're all creatures of habit, right? And I live by action. So one of my patterns over the last 10 years has been exercise. So I have 30 minutes of exercise a day. I've been going on every day for the last 5 years. And I really put it into motion because I saw what I was telling people, and I really wanted to replicate what I was saying. I wanted to do it. It's changed how I live. I get up every day and work out. Sometimes, rarely, I'll do it in the afternoon and evening, but I'm off kilter. And my wife will say, "Hey, you didn't get your exercise in, did you?" Because I'm a little grumpy. But
Mhm.
in the morning, I get up and work out 30 minutes. I also I'm a spiritual guy, and I think everyone needs to have that spirit within them. And that's, again, whatever your religion is. I think there's a higher being, and that guides us. And then serving others, like, again, I alluded to it, that I'm just so lucky that I have a job where I get to help people feel better, and I get to have them say thank you most of the time. I'm blessed beyond recognition. I'm gonna work until I die, because I'm just so in love with my patients and my staff, and everything I can do to help people, and it makes me feel happy. So thank God I just didn't want to become a CPA, because they're important too, but I can't look at numbers all day.
And if
So
you were,
that
if
sounds
you,
all rosy. Like, I definitely get in a bad mood, and I'm a grumpy guy every now and then, but that's how I live. I mean, it's just, I try to put into place, the best of my ability, what I tell people.
yeah, for sure. And if you were CPA, you might have a flat butt, and you might need stem cell, but that's for a different podcast anyway. And if there's any CPAs out there that heard me say that, get out of the chair and start doing squats, and you'll be just fine.
Yeah.
Okay.
Yeah. Easy.
All right. So Matt, what's the best way for people to get in touch with you? How should they get a hold of you? Because I think they're going to want to see you.
Well, again, Mike, thank you for having me. I mean, I have a great staff. I have a PA, Paige Rockers, I hired this year, so I'm pretty easy to see. Bluetailmedicalgroup.com is our website. My secretary has been with me for a super long time. Scheduler is Karen. She's at area code 636-778-2814. But if you just go to our website, it kind of talks a little bit about us. We have several physicians around the country, and you can find us.
Well, we are grateful to your dedication, and just the support you've given to the active aging population in St. Louis and beyond. You see patients, and you're very humble, but you see patients from all over the United States, and I would probably say from all over the world. And you also have Blue Tail in other cities besides just St. Louis. So you guys have really created an amazing empire, and you've only created it because of the amazing work that you've put into this into your craft.
Thank you.
There are and to be good at something, there's no shortcuts. And I've known you all for a long time, and you've taken no shortcuts, and that's why it's becoming an empire. So thank you for your time. And I do hope that some of our listeners do contact you, because you're going to be a big help. But thank you for your time. And I know we went over a half hour, but I'm grateful. And everyone, please come back next week. I actually don't know what our topic is going to be next week, but I'm sure it'll be great. We thank Dr. Bays for his time, and we hope you guys have a great week, and we'll catch you later. Bye-bye.
Thank you.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@imovephysicaltherapy.com. To learn more about healthy aging, visit our website at imovephysicaltherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.